let's talk about back pain. How are you going to do? What is it that you can do throughout the day that can actually help you with your lower back pain or help you not have a lower back pain? I'm Dr. Shakib from Irvine, and thanks for watching, so stay tuned. All right, let's talk about what you can do on a daily basis that you can associate with an activity on a daily basis, working or not, vacation or not, that can actually help you with preventing lower back problem, helping you with lower back issues you may have, or helping, believe it or not, with the little bulge that some of us complain about. So it has to do with picking, in my case, every time I face a counter, I do a tuck under. So that's what the side movement is like. Tucking under is the movement of the pelvis in an upward position, like that. What it does, it allows the lower ab, not just up here, because it doesn't involve the upper part of your ab, but specifically the lower part of your ab, which is on the opposite side of your lower back, your SI joint or sacroiliac joint. So the two of them get to work together. Even though their functions are different, in proper posture, the agonist, antagonist, in this case, the front and the back in this area, get to talk together. And that's what proper posture, proper movement requires. So what you want to do is every time you face a counter, so maybe a bathroom counter, it may be a kitchen counter, as you're washing the sinks, washing at the sink or at the counter, doing cutting or whatever it is that you're doing in your kitchen. Or it may be, let's say, at the office facing a printer, that's kind of like a counter. Or maybe at the front desk talking to someone, that's a counter. So as soon as you do that, you need to automatically associate it with the action of tucking under. When you tuck under, it contracts the lower ab, and it allows the glutes to kind of keep contracted, keep this tuck under position for the duration that you're holding it, which is conditioning the very muscles that as you sit, you decondition. Some of the things to be aware of is as you're tucking under, you want to make sure you don't bend your knees. So this is not what I want you to do. Your knees are straight. It's pure movement of the pelvis in that direction without your torso, the upper part of your body, going into excess curvature or sticking your chest out. Everything other than the pelvis remains stationary. You don't move them, and you simply induce movement in the pelvis in that direction. You may feel a little bit of tension around your hip sockets. Don't be afraid that you're going to mess yourself up. It's just because the ball inside the socket has been jammed so much from too much sitting that this movement is actually moving the socket around the ball. That's all. I hope you enjoy this. Little things do matter, so start associating what is right to different activities that you do throughout the day. You're sitting all day, you're messing yourself up. So, two things I want to make sure you're aware of. Number one is I hope that you're going to subscribe to this YouTube channel because I post videos twice a week. That's a lot of videos, all with you in mind and common conditions I see in my practice and I see necessary to bring it to your attention. So you can get it and then you can save it for later and watch it whenever you can. The other thing is now I have a podcast show called Life and Health Matters with Dr. Shakib. It's available on Google and Apple Podcasts as well as Spotify. It's about life and health matters, not newsworthy stuff. It's the stuff that don't make it out there to the general media, because media is intended for entertainment and not necessarily educational, unless you support your local PBS channel. But anyway, thank you for watching and take care.